Coming in, Dr. David Nabarro, who is the WHO Special Envoy on Corona, in fact, spoke on the latest debate regarding the coronavirus and the scientists claiming it to be airborne. In fact, Nabarro explains that if there is enough evidence to prove that, and what changes then. But he also emphasized and reiterated the need to maintain social distancing as the droplets spread in the most common form.
The new evidence that's being cited in the letter from the scientists is as follows. As well as these droplets, there's also the possibility that even smaller particles carrying virus can emerge from the mouth, and they're capable of traveling further than this 2 meters distance that we talk about. Well, we've always thought that there were possibilities. We weren't sure how many of people getting infected through aerosolized transmission. But we've said that this is not the normal pattern. And I want to stress this. We keep trying to offer guidance based on what we think is most commonly happening, because we're all of us trying to make sense of this and we want to try to work it out. So we have to err on the side of what we believe to be the majority situation. And what the scientists who are writing the letter about now want to say is, could you perhaps also include in your advice the possibility of aerosol transmission? Okay, so then my question back to them would be, what difference is it going to make to the advice that we give? You've summarized it. We need to be trying to be more than 1 meter and ideally 2 meters distance from other people, especially in public settings, to reduce the risk of spread. We also need to be wearing face protection, absolutely essential in order to reduce the risk. But the added threat, I think, that we have to include now, if we're going to take this into account, is a slightly greater distance is needed in certain settings where aerosol transmission is more likely. So I come to my last point. Where is this likely to happen? Answer, when people are shouting, singing, or in any other way really producing a much greater force when they are breathing.
WHO Special Envoy also said that it will take at least 2 to 2.5 years for the vaccine to be ready.
The first thing about a vaccine is showing that it is capable of inducing antibodies in a person who is immunized, and that those antibodies are effective in preventing against the disease, and that the vaccine itself is safe and does not have any side effects. So getting that candidate and doing the early tests is step one. And I would hope that we're going to see quite a lot of announcements in the next few months where that step one of having candidate vaccines is there. Step two is to go through the necessary trials, and they're called phase 1, phase 2, and phase 3 trials that are needed to confirm that it works and that it is safe. That takes a finite amount of time, certainly more than 6 months, and it may take longer still, because it depends on what the results are. And then thirdly, you've got to then manufacture the vaccine in sufficient quantity that it can be given to everybody who needs it, and you have to organize the vaccination program. That's likely to be a lot longer still. So if we can be clear, having candidate vaccines should come pretty soon. Going through the trials could take 6 months or longer. Having sufficient vaccine that's available to give to everybody and administering it will be longer still. And that's why I'd like people not to think in terms of having a vaccine that's ready for everybody in less than 2 or 2.5 years.